Thank you. How are you? Good afternoon. I'm fine, thank you. Good to be here. Right? Good to have you here. Good to have you here. Yes, thank you. All right, so Dr. Mary, please proceed. Okay, so kindly allow me to share my screen. All righty. Okay. All right, please confirm that you can see my screen. Yes, we can see your screen. All right. So good afternoon once again, everyone. You're welcome to our session today. And today we are talking about the silent thief of sight. And especially we are talking about why women face a higher risk of having or developing glaucoma. Of course, this month of March is the International Women's Month. And as much as we are also talking about glaucoma, because this week is the World Glaucoma Week, we also have to be a bit sensitive and also specific about how this silent thief of sight affects women. All right, so for today, we're going to be talking about a couple of things as it regards to glaucoma. We're going to, of course, introduce what glaucoma is, and we'll know what risk factors predispose a patient to having glaucoma. We're going to be talking about the signs and symptoms, gender and how it relates to glaucoma, managing glaucoma, the prevention, and of course, conclusion. All right, now, so first of all, we start with what is glaucoma. Glaucoma is a group of eye disorders that causes damage to the optic nerve, often due to an increase in intraocular pressure. Normal intraocular pressure that we see is between 11 and 21 millimeter of mercury. Now, if we can look at this diagram that says normal eye, there is something called the trabecular meshwork if you're following this red arrow. And what the trabecular meshwork is essentially is a drainage canal. So the way we have our bodies and we have high blood pressure is the same way you can have high intraocular pressure. And what happens here is that the ciliary bodies produce something we call the aqueous humor fluid. And as much as there is production, we know that there should be drainage to maintain a normal eye pressure. And this drainage occurs in the trabecular meshwork, which we have listed or outlined here. Now, in a patient with glaucoma, what happens is this. When there's production of the aqueous humor through the ciliary bodies, sometimes we don't have adequate drainage in the trabecular meshwork for various reasons. Sometimes it might just be as a dysfunction to that trabecular meshwork. Another reason could be the angle or the anterior chamber angle where this trabecular meshwork is housed is too narrow and doesn't allow enough drainage of the aqueous humor. As we can see in this glaucoma structure, once you have your eye pressure being high, eventually it causes a damage to the optic nerve. And when the damage occurs in the optic nerve, what results is blindness. This is the reason why we call glaucoma a silent thief of sight. If you do not do regular checkups, you will not know that you have high intraocular pressures. And if this intraocular pressure is high for a sustained period of time, optic nerve damage is what results. And of course, like we mentioned, in optic nerve damage, what eventually happens is a progressive and irreversible vision loss, which eventually leads to blindness. Now, why do we call glaucoma the silent thief of sight? It's because in the early stages of glaucoma, all symptoms are silent. Frankly speaking, you probably would not notice any symptom. The reason why people are able to pick that their intraocular pressure is high is when they visit and then we are having to take, an IOP measurement. And then we see anything over the limit of 21 like we've established. 21 being the upper limit. So once you have your eye pressure anywhere over 21, it's an indicator for us to do a further testing. And this further testing we do include ophthalmoscopy, CVF, and OCTs as the case presents. Now, in this slide, what we have is just a pictorial evidence of what I've been talking about. If you can see in the first picture, what happens here is that the aqueous humor builds up due to any sort of dysfunction going on in the anterior chamber angle that prevents drainage. If this drainage canal is blocked or dysfunctional, this aqueous humor will give rise to an increase in intraocular pressure all around the eye. And the consequence of this sustained increase in eye pressure is that the optic nerve starts to undergo some damage. And this damage we can see most times when we do an ophthalmoscopy test. When we tell you that we want to use the ophthalmoscope to have a look at your retina, what exactly it is that we are having a look at is this picture that you have on your right. When we look at a normal optic nerve, what we expect to see are the vessels leaving and exiting the eye in a normal fashion. This optic nerve is the plug, I would say, from your eye to your brain. So when you look straight ahead and you are able to appreciate whatever it is that you can see, this image is transmitted from the optic nerve to your brain and the interpretation occurs, such that if there is any sort of death or damage to the optic nerve, vision essentially is lost. When we do an ophthalmoscopy, when we look at the normal optic nerve, this is what we appreciate. Nerves are properly arranged, the vessels are going normally, and the exit point is not very visible. And when we have to grade, we say this patient has a cupping of 0.2. But looking at the glaucoma optic nerve, you can clearly see where the vessels are exiting and entering the optic nerve, such that you almost see a sieve-like appearance. And this is what we always say is a suspicion for glaucoma. So sometimes when your patients present in the clinic, we'll find that you see doctors tell you, oh, you are suspicious for glaucoma. The reason we say this is two reasons. Either your eye pressure is high, or we've had a look with the ophthalmoscope and we have seen a glaucomatous optic nerve. Now, what are the types of glaucoma or the common types of glaucoma that we see, especially in clinic? The first and most common type we have is the primary open angle glaucoma. What is primary open angle glaucoma? Like we already established, the angle chamber, that's the anterior angle chamber now, is responsible for housing the trabecular meshwork that allows for drainage of the aqueous humor. Now, when that angle is open, but the drainage system is dysfunctional, we can see an increase in eye pressure. And this particular type of glaucoma is quiet, is slow, and is the most common type. When you have intraocular pressures of primary open angle glaucoma, then we always tell patients the kind of medication to use. The second type of glaucoma that we have is the angle closure glaucoma. Angle closure glaucoma occurs when the anterior chamber, which houses the trabecular meshwork and the drainage system, is closed or is narrow. This results, of course, in an increase in eye pressure. It's similar to when you have a sink, for instance. When you turn on the tap and the drainage system is empty, as the tap is flowing, the water is being drained, no backlog. But in an angle closure glaucoma, what is happening, the picture of that is that drainage system is blocked, and although the aqueous humor keeps being produced, there will be a buildup of intraocular pressure, and that's pretty much what results in this type of glaucoma. The third most common type of glaucoma that we have is called the normal tension glaucoma. Normal tension glaucoma pretty much has to speak to the fact that optic nerve damage is ongoing despite your eye pressure being normal. Like we established earlier, normal eye pressure is between 11 and 21. Sometimes we have patients who present in the clinic, will check your eye pressure, and your eye pressure is maybe 15 or 16. And ideally, this is within normal limits. But the damage now occurs when we go in to look at the optic nerve. We observe a glaucomatous optic nerve, and sometimes during further testing of the OCT and CBF test, we then see that these nerves are going through damages, and we can classify this type of glaucoma under normal tension glaucoma. And the fourth most common type that we have is secondary glaucoma. This is as a result of something else inducing glaucoma, such as trauma, hypertension, or prolonged steroidal use. This steroidal use we may see in treatments for various systemic and eye conditions, but if you've been on that for too long, it can lead to increased eye pressure that can eventually cause glaucoma. Now, what are the general risk factors that we notice in patients when we are talking about glaucoma? When we speak about glaucoma, people have to be aware of the things that might predispose them to developing this eye condition. One of the most important risk factors is an increase in eye pressure. If the eye pressure is consistently high for very long periods of time, eventually this patient will eventually have glaucoma because that eye pressure will lead to damage of your optic nerve. The second most common risk factor that we also have is age. Ideally, or typically, we see patients present with glaucoma, especially African patients, anywhere over the age of 40. So why we like to bring this to the notice of people is that once you hit the age of 40 or above, it's necessary to include a regular or routine eye exam in your yearly wellness or medical checkup. The reason for this is because such a patient might be at risk of developing high eye pressure and eventually glaucoma. The third risk factor is family history. Typically, glaucoma is very hereditary, and such that we always ask this question during the test. Is there any member of your family that has gone blind or might have had glaucoma in the past? A patient who might have had glaucoma in the past is predisposed to passing this trait on to the family. And why this is because, like we said, it's an optic nerve issue. And so if we have a patient who is having his or her nerve predisposed to having glaucoma, this might also be found in other family members, just the way you can have hypertension being a familial history. Now, we also have ethnicity. People of African descent are at higher risk of developing angle closure or primary angle closure glaucoma. Another thing or another predisposing factor is when patients have pre-existing medical conditions, such as diabetes or hypertension. What these two systemic conditions may cause are vascular changes, especially to your optic nerve, which can cause thinning of the nerve fiber layer. This thinning we can appreciate when we do tests like the OCT, which takes a picture of your nerve fiber and analyzes every area that might have gone through thinning or areas that are predisposed or susceptible to thinning and essentially damage. Another predisposing factor is prolonged use of steroidal medications. Like I established earlier, sometimes when treating systemic conditions, it's important that we employ the use of steroid medications in form of eye drops, tablets, and sometimes topical, i.e. vi creams or applying directly to your skin. If you use steroidal medications for too long, they might contribute to an increase in eye pressure, which if left untreated or attended, it can lead to glaucoma. And of course, the most important or most common risk factor that we have, smoking. Smoking typically doesn't do very much good to the body. And of course, it doesn't do any good to your eye as well. This is because it can cause poor circulation, especially like we explained with the aqueous humor. There might be poor circulation of even blood and vessels in your optic nerve and in your retina, and this might lead to an optic nerve damage. Now, what are the common signs and symptoms that you see in glaucoma? We've established that glaucoma is a very quiet eye disorder. And why is this? Just the way you will have high blood pressure and you don't know until you check the blood pressure. It's the same way your eye pressure can be high and it can go unnoticed for long periods of time. Because of this, we might not be able to get any sort of complaints from your patients directly complaining about glaucoma. Now, what you might see or things that we can advise you to look out for in the sense of managing glaucoma is a gradual peripheral vision loss. And what's your peripheral vision? Your peripheral vision has to do with your corner vision. That's the word I'll use. Meaning, if you're looking straight ahead, you can appreciate things at your sides. So the way I put my hands up like this, I can see both hands on both sides. And so when you're able to see this, it means you have very good peripheral vision. But what glaucoma takes is this peripheral vision. And so because it's not normal that people take notice of when this peripheral vision is becoming smaller, sometimes people can go without noticing that their vision is being lost. The other thing that you may look out for is excessive tearing. This we can also see in conditions like dry eyes. But in a case where a patient has an angle closure glaucoma, you will notice that there is a lot of tearing and most times it's unexplained. It comes with no other symptom, no eye aches, no headaches, no redness. The eyes are just teary. So when you notice something like this, it's important for you to visit the eye clinic as soon as you can to make sure that we are not dealing with an increased glaucoma, increased eye pressure or with glaucoma. Another thing you may notice is blurry vision. or halos around light sources. Halos can present like multicolored circular presentations around a light source. So when you look directly at a light source, you should see light and see that this is what it looks like. But sometimes we have this rainbow-like appearance around the light source. It's an indication that the eye pressure is high. And when you notice something like this, it's important for you to visit the eye clinic as soon as possible. Of course, sometimes patients will present to the clinic with total or sudden loss of vision. Besides, vein occlusions and some other retinal involvements, glaucoma is the primary culprit for sudden blindness. Why is this? We've already established that glaucoma takes your peripheral vision. So as it gradually takes the peripheral vision without anybody noticing, eventually, one day, a patient just wakes up and realizes, I just noticed I can't see out of this eye. When we look at the patient and have a look, most times we find that such a patient has gotten to the end stage of glaucoma. And like we've established earlier, glaucoma that results in blindness is as a result of optic nerve death. And as of today, there is no sort of intervention or treatment in terms of transplant or nerve regeneration surgeries that can recover or resurrect a dead optic nerve. So the priority is to make sure that the optic nerve does not die. Another symptom you may notice is pain or red eyes, especially when we are dealing with acute closure glaucoma. You may notice your eyes are red, they're painful, and in some cases, patients will complain of headaches and nausea. And so, despite the fact that there are some systemic conditions that present with similar symptoms, it is necessary for you to also do an eye test to ensure that the reasons why you are having some of these complaints are not as a result of your eye pressure being too high. Now, this is just pretty much a recap of what we have just mentioned in the previous slide. Some of the warning signs or symptoms that you may notice with glaucoma includes blurry vision, sudden onset of visual disturbance, head pains or headaches, high eye pressure, lacrimation, which is increased tearing. You also have fatigue of organs of the vision. Sometimes you have patients that complain of tired eyes, or the eyes just feel like I feel like sleeping. Some people use that term. And so sometimes when you have this fatigue, it's necessary for us to do a comprehensive eye test to rule out the fact that it could be as a result of increased eye pressure. Another symptom, of course, is halos around light, nausea and vomiting, severe eye pain, or reddening of the eye. Now we've established what glaucoma is. We've talked about some symptoms that you may notice, and of course, to speak directly to why we're here today, which is how glaucoma and the gender relate. Some key risk factors for women developing glaucoma more than men is, for instance, a couple of this. Longer life expectancy. I would say if I were to guess, majority of us on this call today probably saw our grandmothers outlive our grandfathers. And that's just to tell you that there's a higher life expectancy for women and as against men. And so if you have women getting into old age more than men, it means women will present age-related eye conditions more than men. So that's the reason why we tend to see more women developing glaucoma than men. As we've established, beside the fact that glaucoma can be hereditary, it also has a relationship with age. So anybody above the age of 40 needs to be in the clinic as often as possible. And of course, women who are over the age of 40 should present to the clinic even more than men. Hormonal influence. Of course, when we still talk about age and the women, above the age of 40 or anywhere from 45, women start to develop menopause. And one of the things that we see in menopause is that there is a decline in estrogen in the woman's system. Nerve loses its protection. Any sort of spike in your eye pressure can lead to a damage in the optic nerve. And this damage in the optic nerve will result in glaucoma. Another risk factor, or the women develop glaucoma more than men, is because there's a higher risk of angle closure glaucoma. Why? Women tend to have smaller eyes than men. That's the average thing around, such that even the shape. And so when you have smaller eyes, you have narrower chamber angles. You also have narrower anterior or shallow anterior chamber angles. And if the anterior chamber angle is closed or narrow, as we've established, this will cause a blockage to the trabecular meshwork that is the major drainage canal for the eye, leading a patient to have what we call angle closure glaucoma. Another predisposing factor for women, and the reason diseases such as lupus and rheumatoid arthritis. Women tend to present these autoimmune diseases more than men. And these autoimmune diseases can impact the patient's nerve and the protection on the optic nerve, leading to secondary glaucoma. The use of steroids. Of course, like we established, when there's prolonged use of steroidal medications, it can lead to an increase in eye pressure. Besides the fact that there is steroidal use of medications, sometimes, typically the women tend to bleach more than the men. And I'm using this word carefully. Why? Because there is a different word every day for bleaching. Sometimes we use the word toning, lightening, brightening, all of that grammar. The most important thing to note in this is that there is a direct implication or impact of steroid in all these creams that help us achieve this brighter or lighter skin. And so, like we've established, even when you use systemic or you use steroidal medications on your skin or topically, you can still be predisposed to having high eye pressure because the steroid is being absorbed into your skin and into the system, and this can also lead to the high eye pressure that we're talking about. Another reason why women would report glaucoma more than men is because we see a late diagnosis or low awareness in women. And this is primarily because women are the primary caregivers. And because we are the primary caregivers, we are preoccupied with every other person's health. We're thinking about the children's health, we're thinking about our spouse's health, we're thinking about our parents' health, such that we do not prioritize our own health care. And this is something that leads to women reporting glaucoma at late stages at the clinic. It's very important that as much as we are bothered about the family's healthcare, we should also prioritize our healthcare, because if we're not capable of taking care of these patients or these people, people will still have all these conditions. So you must be in tip-top shape to ensure that the family's health is optimal. As we can see in this diagram in this slide, this is what a normal vision looks like. With both eyes, you should be able to appreciate maximum view. From the peripheral to your central vision, you should be able to see the entire picture. Now, in early glaucomas we have in the top right picture, you can see that there are slight and quiet signs of darkening in the peripheral vision. Now, such a patient will go ahead with her life without even noticing that she probably has already started developing glaucoma. But if she presents to the clinic, when we do an eye pressure check, we will notice that the eye pressure is high. When we do an ophthalmoscopy, we will notice the optic nerve is larger than normal. And of course, once we do those two tests, we are made to do a CVF test, which creates a map of your vision. And when we create this map of the vision, all these areas of vision loss is being recorded on this CVF test, such that we can see any areas that glaucoma has started to take. We can also see in advanced glaucoma how this picture as well reduces significantly, such that what patients start to appreciate is just the central vision, or things that they're looking around or looking at straight ahead. Meaning, if they're not looking at you straight ahead, they cannot see you from the corners of their vision. This stage of glaucoma is very important because at this stage, we tend to have patients complaining about bumping into things. They'll tell you, they didn't see the wall there, they didn't see this table there, because their peripheral vision has started to go. So if you're around anybody who has started to bump into objects, telling you they cannot see clearly or they did not see something that was obviously there, it's very important that such a patient reports to the clinic for further eye exam to be sure that we are not dealing with glaucoma. And at the lower right corner, we can see end-stage glaucoma. At this point, patients are pretty much only able to have pinhole vision because glaucoma has taken majority of that peripheral vision. And one way we always tell patients to make sure that their vision is good, when you wake up in the morning, the way you will check and say, okay, my hand is working, my legs are working, okay, I can breathe, everything is complete. You must also check that your eyes are working. And the way to check your eyes are working is by closing one eye and appreciating everything that you can see. You wake up in the morning, you check your left eye, okay, vision complete. You check your right, vision complete. Those are quick tests that you can do at home to ensure that you are not missing glaucoma. Now, managing glaucoma. We've spoken about what glaucoma is. We've spoken about the predisposing factors. We've also spoken about how glaucoma affects women. Now you ask that question, in a patient that's already presented with glaucoma, how do we now manage glaucoma? What is the hope for a patient who already has glaucoma? Now, we've already established the optic nerve is not one that is known to regenerate. And as of today, there is no technique that can help with optic nerve degeneration and regeneration. So what we can do in the meantime is to manage glaucoma with certain therapies, one of which includes medication, use of eye drops and tablets in lowering the patient's eye pressure or helping to improve fluid drainage. Now, when a patient presents, like we said, when we notice the eye pressure is high, the target is to lower the eye pressure. Why? If the eye pressure remains high, optic nerve damage will start to progress. And so the goal in managing glaucoma is to limit blindness or at least reduce the rate of progression of glaucoma. And so when we can manage or arrest the eye pressure by use of medication, you're one step closer to ensuring that your vision is better. The second therapy that we have in managing glaucoma is the use of laser therapy. Now, systems vary, and for reasons such as compliance, some patients do not respond in the way we expect to medications. Sometimes we issue medications. Through the follow-up routine, we find that the eye pressure is not coming down as we expect. And so when we see this, it's important for us to employ another therapy. Although non-invasive, we use the laser therapy. And what the laser therapy does is to create another drainage canal in the anterior chamber angle that can aid or improve fluid drainage, thereby reducing the eye pressure. Now, after we do a laser therapy, majority of the time, we tend to see an improvement. We tend to see patients actually tell you that, oh, I feel much better. In the clinic, we can see your pressure significantly crash down. But sometimes, due to structure or even the type of glaucoma that we are managing, especially in angle closure glaucoma, the laser therapy is not enough to get us the results we want in lowering the eye pressure. And what we do then is to go into the theater and actually physically create these drainage canals or even implant drainage systems that can allow for further reduction of the eye pressure. And so, in terms of managing glaucoma, despite glaucoma being irreversible, if we detect it early enough, with these treatment options, we can manage glaucoma at reasonable rates to prevent it from advancing to advanced or total blindness. And now we've spoken about how to treat. For those of us who do not have glaucoma, we obviously want to know, how do we prevent glaucoma from happening? The first thing you must know is, with a routine or your regular eye exam, you will prevent glaucoma. At least once every year, you should present to the clinic for a thorough or comprehensive eye exam. During this eye exam, we will check your vision, we'll check your eye pressure, and we'll check your optic nerve. And when we do any of these three things, if glaucoma is there, we can catch it on time and start to intervene on time. People over the age of 40 should make it a priority to find themselves in the eye clinic at least once a year. People who have family history of glaucoma should ensure that they have their eye tested at least once a year to prevent any sort of advanced glaucoma. Another way to prevent glaucoma is to maintain healthy blood pressure and blood sugar. Now, we've already established like systemic conditions like diabetes and hypertension can cause vascular damages. And so, as much as you are conscious of the fact that hypertension is systemic, diabetes is systemic, these conditions can actually present in the eye. As a matter of fact, majority of the systemic conditions that we have today can actually present in your eye. So when you walk into the clinic for an eye test, just by using an ophthalmoscope to view your eyes, we'll know if you're managing your diabetes well, we know if you're managing hypertension well, and we'll also know if you're managing things like cholesterol well. And so this is why it's important for us to manage whatever systemic conditions that we have, or even live a healthy lifestyle to prevent these things from happening, because we do not want any sort of implication on our optic nerve. Another thing that we can prevent is to follow our medications as prescribed. When we give you tablets for a certain condition, if we give you steroidal tablets for a condition or eye drops for a condition, there's a period of time that these medications are prescribed. You are expected to only use them for that period of time. If after the period of time where you have this disorder and you've gotten treatment and you feel much better, you should start having symptoms that prompted the use of steroid in the first place. Instead of starting the medication without guidance from your doctor, please ensure to visit the doctor for proper prescription. The reason is because if you self-medicate on steroid, you predispose yourself to having high intraocular pressure. And if your eye pressure is high, it can as well lead to optic nerve damage, which can eventually lead to glaucoma or irreversible blindness. Another way to prevent glaucoma is through exercise or just healthy diet. When you exercise a lot, of course, your vascular and your vascular health is decent, and as well as all the vessels in the body. Another thing healthy diet does for us is that it provides nutrients such as lutein, zeaxanthin, and omega-3 fatty acid. These nutrients are very essential in retina health protection. Yes, indeed, majority of the eye conditions that we have that potentially can lead to blindness are age-related. But if you are taking a lot of these nutrients in good amounts, now, of course, overdoing things is not encouraged in any way. But if you are doing things properly, such that you are able to get your nutrients from the lutein, the zeaxanthins, through any of these options, like your fruits, your food, vegetables, what happens eventually is that despite you aging, your eye health is optimal. And it is protected to the extent that sometimes we have patients who are in their 60s and 70s, and typical eye conditions like macular degeneration, we don't see it in them. And this is where people who take supplements benefit from a lot. So when you have your regular supplements, what it does is that it provides your body with these nutrients that you may not be getting adequately from your food or from your diet. And so it's also encouraged that when you're being prescribed, routine medications such as your nutrients or your well woman or your well man as well, these kind of medications support your eye health and ensure that you are living healthy and your eyes are protected. Of course, another preventive measure is to protect your eyes from UV rays, where you get mostly from the sun. Thermal injuries or excessive heat can actually cause significant retina damage. Today, we have some instruments actually that can take a picture of your retina, and it can analyze if you will have age-related disorders. And so some of these age-related disorders can be as a result of exposure to UV light. Some people say, oh, sunglasses, it's people that are stylish that should wear sunglasses. It's true. If you're stylish, your sunglasses tend to speak to that. But there are also options for people that feel like, I don't want to be too loud in whatever ocular protection I have on. You can use tinted lenses or even photochromic lenses to reduce the exposure to UV rays, which can cause damage to your retina. The best way to protect your vision is to make sure that you are doing things proactively to ensure that your eye does not start going through any sort of damage, because any damage that occurs to your retina or to your optic nerve most times is irreversible and can lead to blindness. In conclusion, although there is no cure for glaucoma, early detection and treatment can help slow its progression and prevent blindness. People over the age of 40, those with a family history, women, and individuals of African descent are at higher risk and are encouraged to book yearly eye exams to ensure that they prevent these occasions of irreversible blindness called glaucoma. Thank you.
Thank you, Dr. Mary. Thank you. Please, let's leave a reaction. Let's probably leave a clap or something, or like thumbs up for Dr. Mary. That was an incredibly insightful discussion. So please, let's remember to leave our questions in the Q&A box. We can just drop our questions, or we can drop it in the chat box, because we're about to move to the question and answer session. So if you haven't already, this is the perfect time to drop your questions in the chat box or in the question and answers box. For me, I think what I'll just want to ask from you, Dr. Mary, is that you mentioned a couple of very difficult, you used some very difficult vocabulary, vascular damages, this and that. And I think what I would just like to ask is if there's a takeaway, if there's something that you want us to leave with today, like in just layman's terms, what would it be like, without something that we can really, really understand that, okay, if this is one thing that I really picked from this session today, this is what I left the session with. I don't know if you understand what I mean. So if there's something that we can say that I learned this today and I'm keeping this for myself to improve my eye health long term, this is what the thing is. Thank you.
Okay, so the key takeaway from here today is, first of all, to ensure that you have regular eye exams. Regular eye exams, at least once a year, you should visit the eye clinic. When you do visit the eye clinic, like we established, we'll check three things. We'll check your vision, we'll check your eye pressure, we'll check your optic nerve. A patient who has glaucoma will default in any one of these three. If your vision is affected, if your eye pressure is high, or the optic nerve is higher or larger than normal, these three things can then prompt us to do further testing like the CVF and OCT to either confirm or cancel a diagnosis of glaucoma. So it's important, first of all, to present to the clinic. At least once every year, you should be in the clinic for us to have a look at your eyes.
All right, thank you. So Dr. Mary is encouraging, if I understand Dr. Mary well, you're encouraging that the importance of early detection and proactive eye care. So we have to be proactive when it comes to our eye health. Thank you. So please, let's leave our questions so we can attend to all of them.
So there's a question
At
in
once.
Q&A box. So somebody is asking, does looking at the screen for too long pose a risk for glaucoma? No. What looking at the screen poses a risk of more is something we call computer vision syndrome. So you can have ocular surface disorders, which include dry eyes. You can have tired eyes. You can have eye strains as well. And so when you have a lot of discomfort around looking at your screen for too long, these are the things. It's just a general discomfort that's over a period of time, if not properly managed, can lead to macular degenerations. But will it cause glaucoma? No. What causes glaucoma is an optic nerve damage. But when you look at your screen for too long without any sort of protection like your anti-blue coatings or the screen guards, what you are exposed to are blue UV lights that can cause macular degenerations. So that's what long exposure to your computer without any sort of anti-reflective glasses can cause. But for glaucoma, that's totally independent and has to do with your vessels.
All right, Lucy, I hope that answers your question. All right. Please, if you have other questions, please leave them. Dr. Mary.
Yes, please.
What is the direct link between high blood pressure and, or if is there a direct link between high blood pressure and glaucoma?
As a matter of fact, yes, there is. So if a patient has high blood pressure, two things will happen. Consequently, your eye pressure will also be high. And if you have high blood pressure, it means that you already have some sort of vascular changes that can weaken your optic nerve. So if you have hypertension and you're not properly managing it, you can be at risk of developing glaucoma.
All right, thank you. One more question from me. So
Yes,
if one has glaucoma and then one has like blindness in possibly the left eye or probably the right eye, what are the chances of it spreading to the other eye?
okay, so if we're talking about glaucoma-related blindness, in fact, what am I saying half the time? The reason why people will go blind on one eye first is because they came late to the clinic. Otherwise, glaucoma is a bilateral condition. Glaucoma will affect both eyes eventually. It will start from one. One eye will definitely be worse than the other, but the natural progression for glaucoma is to take vision on both eyes because it has to do with the optic nerve. And so we have our optic nerve connecting from our eyes, and then they have where they intercept and then transmit into the brain. So if they have a meeting point, that meeting point is where it is very easy. So if we're saying you have vascular damage that has resulted in glaucoma on your left eye, for instance, of course, that vascular damage is still present in the right eye. The only question is which one presented first or which one is progressing faster than the other. And so we have a couple of patients who are managing glaucoma as of today, and they just have vision on one eye. And like I said, it's because of the time that the patient presented to the clinic. So it's very important to present early enough. When you're able to present early enough, we can prevent blindness. But when you present at the point where one eye is already gone, it's a fight to struggle to ensure that the second eye is protected against such happening to it.
All right. Thank you, Dr. Mary. Thank you for sharing your expertise. I do not think that we have any other questions.
There's a question somebody is asking. Dr. Sola, can we ensure all our wellness packages have glaucoma screening? Yes, all our wellness packages do. The primary, so from the smallest to the biggest package, what happens essentially is this. With the smallest package, you get your vision assessed, you have your eye pressure checked, and you have your optic nerve checked. So you shouldn't be too worried about, oh, it's too expensive. Even if you can afford the most basic package, you will still have a very good glaucoma screening option there. Now, what happens with the higher package is that we are able to do these tests like the CBF and the OCT test that pretty much is able to tell us if this nerve is susceptible to damage or not. So if we do an OCT test and we see that the nerve is susceptible to damage, it means that you are on a very good, like you are on a watch list because you can develop glaucoma at the slightest increase in your eye pressure. So that's what the highest package affords you. It affords you being able to do that retina exam that allows you see. But with your most basic wellness package, you can have a basic glaucoma screening done. Okay, somebody saying some ladies do take drugs to get fat. Does it cause glaucoma? Is it to get fat or to lose weight? Because I know we're in the Ozempic era. So I don't know about the medications to get fat. I'll be very honest with you. But I can talk about the Ozempic pandemic a little bit, and this is why I said so. So with Ozempic, what we are managing with Ozempic most times is diabetes. And for a patient who already has diabetes, we know that this is a patient that is predisposed to vascular damage, that is also predisposed to having optic nerve damage. But if you're using Ozempic now, when you do not need it, all that is more like an assault to your vessels. Regardless of every other thing, I believe we have been hearing the I'll use the word jingles, but pretty much people are talking about the reason why you shouldn't be using Ozempic when you do not need it. And it's because of the side effects. So when you do not use you don't need certain things and you're using them, you run the risk of having or increasing the toxicity level in your body. And there is a side effect for that. And one of it is that it can damage your vessels. And glaucoma occurs because your vessel is damaged. So if you use Ozempic and you damage your vessels, you should just pray not to have very high eye pressures, because the minute your eye pressure goes up, glaucoma is just somewhere around the corner. Okay, so somebody is saying, I have tired eyes all the time, even though I use my glasses all the time. I have glaucoma and always have to go to the doc, yet the tiredness continues. Two things. If you have glaucoma already, are you using your medication as prescribed? When last did you visit the clinic? Using or prescribing medication is not the end of treatment. It's just the beginning of the treatment protocol. When we see a patient who we establish has glaucoma, we pretty much create a map of how we want to manage this disorder, from how low the eye pressure should be to what the vision should look like every time the patient presents to the clinic. And so when we give you follow-up visits or follow-up appointments, the need for that is to ensure that at every follow-up, such complaints are being addressed. If you're using an eye drop and you don't follow up, sometimes we even see it in managing hypertension. Some people will say, oh, my blood pressure is high, I'm going to buy amlodipine. Sometimes your body is different. You probably won't be responding to amlodipine the way you want, or your eye pressure or your blood pressure will not be responding to the medication in the way that you expect. And so over-the-counter medications or continuing medications without follow-up is not exactly very good when managing glaucoma. Because like we said, if you're not responding to this medication, despite you religiously using your eye drops, your eye pressure can still be high and your optic nerve can still be damaged. So two things I will advise you to do. You come back, have a visit, let's review your glasses. If your glasses are scratched or require an update, you will experience tired eyes. If you're using the computer a lot and your glasses do not have any sort of anti-reflective coating, you will experience tired eyes. If you're using your eye drops and your eye pressure is not coming lower than what it was or lower than as what we want it to be, you will also experience tired eyes. So for this patient, I would advise that you please make time out, schedule an appointment, and revisit for us to do a quick assessment. Okay, so I have another question from Olatunde. Piggybacking off the earlier question of being blind on one eye, is there a possibility of not going blind on the other eye? Yes, there's a possibility. If you catch it on time, if you're using your medications on time, if you follow your routine follow-up appointments on time, everything that we have discussed today, if you are proactive with your eye health, there is a possibility that you will not be blind on the second eye. And Rosalind is asking, I don't have eye challenges, but I feel worried about the number of hours I spend on the laptop due to work and school. What advice do you have for me, given my mom and dad had glaucoma and I am above 40? So two things I'm going to advise you to do. Visit the eye clinic, 1. 2, schedule a routine test. Now, every year when you come to the eye clinic, you must not change your glasses, but we will assess and check that every structure is functioning the way it should be. With the familiar history of glaucoma with your mom and your dad, you should be in the clinic once every year. It is very important. If at any point we notice for you, when you come into the clinic, it's going to be a full glaucoma workup because of the history. So you don't have to actually present with high eye pressure for us to do a full workup for you because of the familial history. We'll check your optic nerve. We'll also do a map of your vision. If these two tests are good, then we're just going to ask you to come once every year. If God forbid the case comes up that it's a suspicion for glaucoma, then we can commence treatment as soon as possible. And whatever vision you have now, we can work towards preserving and preventing blindness. And so similarly, someone asks, my dad has glaucoma, so I'm very conscious of my eye. However, I've had repeated eye itching, several visits to the doctor say I have dry eye. Despite the eye drop prescribed, this still persists. Dry eye is very persistent, very, very, very persistent. With dry eyes, it's most times a result or as a result of the quality of tear being produced. Now we have a tear film. So the way I'm looking at you and you can see my eyes, for me to blink, with every blink, from there is a tear film consisting of 3 layers: oily layer, liquid layer, mucus layer. When we are crying, it's the liquid layer that is predominant. But in resting state, all 3 layers are equal and complete. Now, when you have dry eyes, it's a dysfunction problem. Either your lipid layer is not sufficient enough, and so when you are seated in the front of fans or AC, evaporation is going on because that oily layer that should prevent tears from evaporating is thinning out. So you will have a lot of dry eye because of exposure. Another issue or another reason why dry eyes will persist is systemic issues. If your diet is not rich in omega-3 fatty acid, you will have dry eyes. Another reason you will have dry eyes and it will persist is if you're a woman over the age of 40 experiencing menopause. Part of the things that women will experience over the age of 40 is general dryness in the body, which typically is why women start to develop arthritis in old age. And so if you have this dryness, in fact, you don't even have to be over the age of 40 as a woman. Personally speaking, I have dry eyes and I'm not over the age of 40, but that's just because with women, there's a lot of hormonal, highs and lows that we go through during the month. And at every point in time, your estrogen can be high, your estrogen can be low. All this craziness going on can contribute to you having dry eyes. So if you're a woman in tech, number one, you should have your glasses on your face every time you're using your computer because it will reduce the rate of evaporation of your tear film. And number two, ensure that your diet is rich in omega-3 fatty acid. When it's rich in omega-3 fatty acid, it will prevent the evaporation of tears and will prescribe teardrops. Teardrops are a supplement. They are to help you, to support you, so that you don't feel uncomfortable with this dry eyes. You're welcome, Rosalind. So let's see, do we have any more questions?
This is very expensive.
I think we've answered all our questions for today.
All right. Thank you, Dr. Mary, for sharing.